Healthy choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back to GTU. There is a new innovative program being offered to moms with questions or concerns about breastfeeding.
And joining us now in the sponsored interview to tell us more is Dr. Maureen Kobabe from Intermountain Health. Doctor, thank you so much for being here.
Thank you so much for inviting me.
As moms know, breastfeeding is a complicated issue or factor in our lives, but we want to give the best for our babies. Tell us why it's so important.
Breastfeeding is so important because it offers huge nutritional, metabolic, immune benefits for babies. It helps moms achieve a healthy weight and a healthy connection with their babies. Most women want to breastfeed after they deliver their babies, but not everybody that wants to is able to. And the percentages of women that are successfully breastfeeding a few months down the road after they deliver are way lower than the number of women that say they want to.
That's so interesting. You're just at the mercy of whatever your body is going to do. And there's a lot to learn when it comes to breastfeeding.
Absolutely.
And we do need somebody to come in and say, when could I expect the milk to come in? I've just given birth to my first baby. Or how do I help them latch on? There's a lot to know. And how do you come in and help us with that?
So what we're offering is a telehealth lactation service. Previously, most of our lactation consultants have been based out of our hospitals, out of our mother-baby units. And that's great. It's great to try and work on that latch those first couple of days in the hospital. But some of the most challenging times can be after you come home, after the milk comes in at full volume, or as new challenges arrive, as baby gets sick or baby gets teeth, or something new comes up. And so what we're able to offer now is a telehealth consultation with those lactation consultants so that you can see them from the comfort and privacy of your own home rather than trying to pick up your baby, potentially your other kids, go out of the house to meet with someone.
And I was one of those moms who went home. I had trouble. It was painful. And I had to gather everyone and go and see a lactation expert. And it almost made me not want to go. So I love the fact that you have an option for telehealth. What types of issues can you cover over the phone?
Great question. So we can do a lot with over or under supply issues, the discomfort that comes with initially trying to establish that breastfeeding relationship, even some latch issues, although it can be a little bit more difficult to evaluate a latch on camera. We can do a lot to correct those and give advice on how to get a more comfortable latch, make it less painful. The only real challenges are things where we need to, show how to use a device, or we need to do a weighted feed. Those ones we can refer to our in-person lactation consultants.
Telehealth is incredible, and especially for something like this, because you get home, you're overwhelmed, and sometimes the last thing you want to do is then pack up the brand new baby in the carrier and go back out. But there's so many reasons why you might be having trouble. Maybe it is that low supply, but you can boost that. Or I've even had girlfriends say my baby had a tongue tie that needed to be clipped before they could properly latch.
Yeah, and so sometimes the first chance to get guidance on the challenge that you're seeing may be this telehealth consultation. And then if you need referrals to an in-person lactation consultant to do more of an exam, or to somebody who does a tongue tie correction, those can be arranged. But sometimes just getting on the right track, getting that initial guidance is so important.
And I think it can be so frustrating down the road when you want to breastfeed for an extended amount of time, because statistics show that most women, like you said, 92% of women start breastfeeding, and then it drops off 6 months later, almost to half. So maybe we can catch some of those moms who are so frustrated and may give up. Maybe talk to an expert on the phone.
Yeah, and help them achieve their goals.
Yeah, so how do we make an appointment? How does it go about? Is it like a regular doctor's appointment?
That's a great question. So it's through Intermountain's Connect Care service, and you call and our appointment is arranged by one of our telephone service representatives, generally within 24 hours. We are available 7 days a week. and can get moms in for that consultation before they feel like they just have to give up.
Oh, thank you for making it so easy for us and accessible. There's also things that you might deal with your own body, not just the baby, but you can be engorged, you can have clogged ducts, and if it weren't for the experts, I wouldn't have known what was going on or what any of that even was, so it's crucial. Thank you so much. This was a super important segment today. And again, virtual or in person, right there, Connect Care Lactation Support at intermountainhealth.org. Thank you.
Thank you.